Experiencing joint and bone pain and having to wait a long time at the emergency room to see a doctor? Well, Tan Tock Seng Hospital is hoping to change that with their new care plan for patients with musculoskeletal conditions. Under the new care model, patients can see a trained advanced practice physiotherapist or APP instead of a doctor right after registration and triage. These APP are trained to independently treat musculoskeletal injuries and spinal pain, as well as order medical imaging. And this cuts down on the patient's pain with quicker treatment and also time in the emergency department.
And for more on this, we're joined by two guests from Tan Tock Seng Hospital. Jason Low, Principal Physiotherapist at the Department of Physiotherapy, and Dr. Terence See, Senior Consultant in the Emergency Department. Gentlemen, welcome to both of you. Dr. See, first to you. How has the change in the care model helped you manage your load in the emergency department?
Well, I think with advanced practice physiotherapists like Jason around, they help to take off some of the musculoskeletal load from the emergency doctors. This frees up our doctors to focus on more critically ill patients as well as the more complex.
Yeah, it seems that we're having a little bit of a connection issue there. But Jason, while we're trying to get that sorted out, let's bring you in on the conversation. What are some of the more common, musculoskeletal conditions that your patients come and see you with?
In Tan Tock Seng Hospital Emergency Department, the more common musculoskeletal conditions that we encounter are like muscle strain, joint pain, back and knee pain as well. So these are the more common conditions that we see in emergency department.
And Jason, you will have lots of different clients with different conditions. Tell us something about the physiotherapy that you might typically have to administer to these patients, and how does this actually help earlier care interventions?
As an APP, I will do my assessment, run the investigation like X-ray if needed to confirm the diagnosis. I will discuss with the ED doctors regarding the assessment, findings, and management plan. Once the doctor agrees with the plan, I'll proceed with the management, which may include patient education, teaching them of how to exercise, and also manual treatment if needed. This will help the patient in the early recovery phases.
Yeah, Terence, let's see if you're back with us.
I'm here.
Yeah, so physiotherapists like Jason and yourself, you guys work quite closely together in terms of, assessment, ensuring that the patient is well taken care of. Describe some of that synergy that you would be seeing over at the hospital.
Well, I think it's a very useful kind of synergy. Jason sees the patient first, and subsequently he comes over and discusses the case with me. I think the most useful part about this program is that sometimes patients come to the emergency department with what they perceive as musculoskeletal complaints. But sometimes it turns out to be more than meets the eye, and advanced practice physios like Jason are trained to pick up these medical conditions which may be masquerading as musculoskeletal conditions, and he can flag these up to us, and then we can initiate the appropriate investigations and management after that.
Dr. See, these days, people might tend to Google their conditions. They might try to sort of self-diagnose often, even before seeing a doctor or even choosing to see a practice physiotherapist. How willing are they to see an advanced practice physiotherapist instead of a doctor if they're advised to?
Yeah. Well, I think because this is a pilot model of care, I guess sometimes when the patients arrive at the emergency department and they first see a physiotherapist, they may be a little bit surprised. But however, from my interactions with the patients who have been managed by the advanced practice physios, at the end of the day, after they finish their consultation and they've received their treatment from APPs like Jason, most of the time actually they have great satisfaction, and probably even more so than if they had just seen a doctor alone. Yeah, I think the issue about the being not confident about the diagnosis usually is not really an issue, because the APPs like Jason, they come and discuss the case with us, and quite often we go over just to have a look at the patient, make sure they all think they're all okay, and then that lends confidence to the process, to both the patient as well as to the APP like Jason, that their clinical assessment and their management is accurate.
Yeah, Jason, let's come back to you. I think it's all in the name. Advanced, practice physiotherapist. That means, you're kind of different from regular physiotherapists, if I may say so. I'm assuming that it requires a bit more training. Dr. C also mentioned, you may have to diagnose initially first. Give us a sense of the kinds of training and the kinds of upskilling that you've had to go through to land this role.
Okay. So as an APP, before we can become an APP, we need to go through a series of training. The training includes observation with the doctor at emergency department and also the orthopedic surgeon at the SOC clinic. So we also had to go through the imaging interpretation with our radiology. Then also we need to go through some reading material and also online reading material. And also we need to take a practical exam as well in the simulated environment. We need to go through like case management, management audit as well. So it's quite an intensive training to ensure that the patient care are not compromised. And also we are aware about what is the risk factor and what is a serious condition and when to highlight and escalate to the doctor if it is not normal or typical MSK cases. So this training are quite intense.
Well, the journey back to good health can be a long one. Jason, Dr. C, thank you very much for joining us this evening to talk about this issue. Jason Low there and Dr. Terence See from Tan Tock Seng Hospital. Thank you.
Thank you.